Everybody here. This has been a topic that's been near and dear to me since I started here in Houston 2003. Started publishing in it in 2009. And I was telling Melanie here that I chose intentionally to do it in the summertime rather than right before Christmas, because when I did it right before Christmas, I got all sorts of hate mail and death threats and everything else. So I'm serious, it was rough. But Pam, why don't you go ahead and start the thing out, introduce yourself, and then I'll go on
All
down to
righty.
Julie.
All righty. I can do that. Hello, everybody. My name's Pam Esser, and I'm Executive Director of the Attention Deficit Disorders Association, better known as ADA-SR. We've been involved with this collaborative since the beginning, and I've learned an awful lot of interesting information. We have virtual support groups right now, 4 per month. They'll start again in September. And then we have a summer seminar series. So we have 2 more of those coming up. And then we'll start our fall series in September. So check us out. We've got a lot of information. I'm going to put my email and our website in the chat. We're glad you're here.
Excellent, Pam. Thank you. And of course, there's nobody with ADHD as a gaming issue, right? All right, Julie, go ahead.
Hi, everyone. My name is Julie Pomerantz. I'm with the Hub Houston. Hub means heard, understood, believed in. We have 4 different programs. One of them is actually a school. For all of our programs in our school, we serve people with neurological differences. The school is for ages 13 up through 18. Separate from that, we have 3 different young adult programs. One of them is Life 101, which is an employability program that takes place during the day. Secondly, we have Club Hub, which meets 3 nights a week, 1 weekend day a month. And that, again, is for young adults, strictly social, just to have a great time and make friends. And then finally, we have Aspire Accessories, which has its own campus. Again, young adults, we refer to our members there as artisans, and they create magnificent things and sell them at markets and online. So that's the Hub. Thank you so much.
Thank you, Julie. That's great. We do not have Brooke here, who's with Fusion Academy as our other sponsor, but Catherine, would you mind telling everybody about Fusion Academy since you have a child there? Caught you off guard, didn't I? Unmute yourself.
Oh, I'm sorry. What
That's
was the
okay.
question?
No, I was just saying, since you have a child at Fusion Academy and they're one of our sponsors, could you tell people about Fusion Academy?
Okay. It's a private school that has one-to-one teaching. It's grades 6 through 12. So it was a game changer for us because the public school was not providing faith and meeting needs. And to finish high school, he really needed that more of that one-on-one in the teaching. Does that help?
That helps. Wonderful.
Okay.
We started this back in during the early summer, late spring of 2020, just as we got really cranked up with COVID, and we've continued it throughout the time to be a source of information, education. We change topics. We have different guests appearing. I'm Dr. Ron Swatzyna. I run the Houston Neuroscience Brain Center, and we've been striving to bring neuroscience into everybody's life. I find it so fascinating. I'm actually classified as a neuroscientist because I've published in brain science and brain abnormalities, and I really enjoy this work. I think it's something that we have to keep in mind, and I'm going to bring a lot of it into the presentation today. I started here in 2000. Well, give you a brief background on my history. I didn't get here through the normal route. I'm your traditional ADHD guy that played a lot of football, got a lot of brain concussions, flunked out of college, sent me to Vietnam when I lost my draft deferment. Became a commercial diver. That industry went out in 1980, progressed on with, got in eventually on with the Arlington Fire Department, spent 20 years, so I'm a retired Arlington firefighter right now, drawing a retirement check, and got into brain science in the last part of my firefighting career. So I went to Desert Storm for a year, got back and said, I got to finish all my degrees. And so Finished my bachelor's in 95, my master's in 97, my doctorate in 2004, a year after I came to work here. So it was quite a journey to get here. But I think my background gives me a really good understanding about the different nuances of, it's funny how the different fields I've been in have really helped me kind of understand the brain a little bit better. So, and Miss Emma, you want to introduce yourself and your journey?
Sure. Can everybody hear me? I want to make sure that
You're good.
Okay, perfect. So my name is Emma Barr. I work with Dr. Ron at the Houston Neuroscience Brain Center, where I do neurofeedback there. Prior to that, I worked with Dr. Rod for about a couple of years, helping him do research, and still working on that today. I also work at Houston Therapy, where I provide therapy services, and we do ADHD assessments here.
And your license is what?
I'm a licensed psychological associate.
Right. So eventually, when she gets through with her provisional licensing, she'll be able to do all sorts of psychological testing for psychologists and stuff.
Mm-hmm.
So,
yep.
Okay, let's get this going. I'm going to share my screen with you. And I should have it up here. I don't. There it is. Okay. Let's go back to the beginning. I changed my PowerPoints up to the last minute. I've always done that. I don't understand how people can just be satisfied. Every time I look at something, I got to change it. So back to the ADD and me. So this is internet gaming disorder. Internet gaming disorder is actually in the DSM. It has been classified as an addiction and mental health disorder. The World Health Organization's also, acknowledged it, and it's having very negative impact on families. And I think that's why most people are here. But we do know that the basic understanding concepts of why people are concerned is because the more hours we find that our kids are playing, the poorer their grades, the poorer their social interactions, and the worse their behavior becomes. So the criteria, well, let me blow this up and get the big one here. There we go. So the criteria is a preoccupation with online gaming. You got to have 5 of these to be diagnosed with this. Unpleasant symptoms when the games are taken away, need to spend increasing amount of time, unsuccessful attempts to control your participation in the games, loss of interest in previous hobbies and entertainment, continued excessive use of game, despite knowing that they're a problem, deceiving family members or your therapist about the amount of time you're spending on the games, and the use of the games to escape, and losing a significant relationship or jeopardizing those careers, education. I was just talking with Melanie before we opened up about the sad things we see as young guys, mostly guys, go off to college, and they end up not being able to self-regulate their gaming, and they don't go to class, and they flunk out the first or second semester, and they come home defeated. And I've got 5 that I've been working with, that I worked with over the past 20 years, and that I know of still, that are living at home with their parents, no school, no relationship, no job. They don't want anything but just be inside playing the games, and we can't get them out. So they're the permanent fixture, permanent adults in their parents' home, and that's really kind of sad. I hate it. Last year, I had a group of head people from the substance abuse world come to me because of my gaming publications and everything else, and they wanted to see if we could design a internet gaming disorder program. So I worked with, we were working with the Louisiana State University, and we had an hour a week meeting. I guess it was for over about 5, almost 6 months. It never got completed, and I think maybe I was partially to blame for that, because they kept trying to fit internet gaming disorder into the actual substance abuse model, and it won't fit. You can't fit that square peg in that round hole. They're completely different. We're going to get into some of that in just a minute. Now, in identifying the different impacts on the brain than substance abuse disorder, there are structural changes that are different than there are in people who abuse alcohol and drugs. Reduction in gray matter volume and white matter density in the ones with that are internet gaming disordered individuals. Those with ADHD have an increased susceptibility. That's why I was making some comment towards Pam earlier. Excessive playing video games activates many brain regions associated with cognitive, motor, and sensory function. And this does not occur in other forms of addiction. So we do have a different what would you say? A different way to look at how it impacts the person. But we have a different way also to understand this concept about delayed gratification versus instant gratification. Instant gratification is basically what video gaming is all about. Miss Emma, I'd like you to talk a little bit about, because all of us look to be an older population, and what's the premise about gaming? Explain from a gamer's perspective how this all works and how it sucks you deeper down that rabbit hole.
Yeah, as you mentioned, I do play video games. However, I do also have a job and get all my things done. So I'm not one of the target population here. But yeah, anybody who's seen the development of video games over the past few decades, as it, like, the graphics get more impressive, they get more realistic, the narratives get more engrossing. I mean, think about maybe your favorite fiction novel or your favorite movie. Video games are pretty much, the storytelling is that sophisticated that it's kind of like an interactive movie or an interactive book. You get to participate in the story. So there's a lot of reasons that these games become more engrossing. They just like suck you in more. And it can kind of, trying to think how to phrase this. I guess that's just where all the time goes. The games get longer, they get bigger, they get fancier, and it really doesn't, companies aren't going to make any money if their games aren't really addictive. Could make that argument about a lot of substances, but yeah, so that's kind of the concept of the instant gratification of these games.
Great. I had one of my young guys, Miss Emma, that he was quite the aggressive, had the headphones. He was late teens, early 20s. He would drink and scream and shout and had the great console things, and he was really kind of like out there. And but personality wise, he seemed to be just kind of mild and meek and didn't say too much. And I asked him one day, I said, tell me about your avatar. Who are you in the games? And he said, I have several avatars. And I said, well, which one's the best? He said, Crusher Warrior. I said, all right, I don't want to talk to you. I want to talk to Crusher. All of a sudden, his complete demeanor changed. It was really weird. And he got this deeper voice and everything. What do you need? I said, evaluate this player. Let's say his name was Brad. Evaluate Brad here. He said, he's fat, he's lazy, he's irresponsible. I said, what do you do with a player like that? Without hesitating, he reached up and said, delete. I went, are you serious? You know what's wrong with him? Why don't you fix him? He said, too much effort, delete. And at that point in time, I really got the impression that he had become the life support system for a cyber entity that didn't exist. So outside the games, he really was not proud or anything of himself. Inside the games, he was just. Can you talk to that a little bit about how it gets you into that almost double, a split personality or something?
Yeah, if you think about anything that you're particularly just not happy about yourself, whether it's aspects of your personality or physical appearance or just even how you spend your time, the normal reaction would be to invest the time and effort into, resolving those things, to self-improve. But when you get used to a world where there is only instant gratification, where, everything can be solved in maybe an hour of work or by deleting your save and reverting back to a previous save, then, you kind of lose that ability to really appreciate putting in time and effort into self-improvement, into things that aren't immediately gratifying.
Right, exactly. And that's what I was looking at, the delayed gratification. You know, I thought that when it came out with the Guitar Hero game, I thought what an opportunity that the video game industry had if they would have just used a pickup on an electric guitar and let you jam with the greatest people and not just an air guitar, a stick, and pretending like you're playing. They had the opportunity to do it, but they didn't do it because they were teaching more instant gratification than delayed gratification. So it was just like, I think there is a time and place for something like this to really benefit our society, but it's not like you're doing it right now. So the development of psychopathology in adolescence is a study that I did in 2000 in one of my Ph.D. classes. And it was in inpatient psychiatric adolescence unit. I was working there, and I had to do a project for my class, and I asked if I could do a real one instead of a fake one. They said, oh my, that would take IRB approval and everything else like that. I said, what do I need to do? So I did it. I got IRB approval, and I did this qualitative study. But it's about, that's when I really got the insight as to the nuances of what creates psychopathology in adolescence. And as I went through there, internet gaming history, the substance abuse population that were frequent flyers most often had some sort of history of abuse or neglect. The gamers that came through there, we didn't have too many that were frequent flyers, but the ones that did come through there had a history of overparenting. And so let me see if I can get this down. Okay. Overparenting turns out that when I put all the different things that could keep a person from validating themselves as humans, this became the invalidation model. If anybody's interested in the paper we're finishing, I'm actually going to publish it this year, but it's quite an interesting thing. But the overparenting concept comes from either termed helicopter parenting, intensive parenting, overprotective parenting. It prevents normal social development. Now, I do admit that these parents come at this from, and I think I say that next slide, a very honorable and loving position. Parents just want to protect their kids, their children, and keep them from failure. I mean, I can understand that with all my heart. Kids are your most precious commodity. But they prevent this normal social development. Parents in these cases make a lot of their child's decisions, sometimes all of their child's decisions. They solve their problems. I had one mother that said that was did every homework assignment, every project for their child in high school because he had to get into a better college. And I said, that won't work. You can't go with him to college. And so it's just these kind of things we see it with negative impacts on the child. This is all documented: lower self-esteem, ineffective coping skills, mental health issues, narcissism sometimes, and entitlement, and dependency on others. So we want our children to fail. If anybody's interested in a neat study they did back in the 70s with a bunch of mice, Universe 25, just type that in. I'm going to put that into the text, into the chat. Universe 25. It will blow your mind about this study about rats and, making it so easy on them and what happens to those societies. So I've designed, working with this team, I worked on designing a complete treatment facility, treatment program that would go over a course of time. And I've got it down now. I've got the number of sessions and everything else. So I thought I would put it together and be the first one to offer in the city of Houston an internet gaming disorder treatment program, because we don't have them specifically for internet gaming. And so first we got to screen for physiological issues and underlying in mood and behavior that may underlie your mood and behavior. I just have been working all spring long on all the abnormal labs that will create psychiatric issues such as anxiety, depression, psychosis. People don't realize that vitamin D deficiencies in all of our kids are leading to higher incidence of anxiety and depression, direct link to them. You can't treat that vitamin D deficiency with the psychiatric medication or with psychotherapy. You got to look at correcting the labs. So we'll look at that first, because we know that these individuals also as I say in this third point down here, they eat terribly. Their gut is probably in a lot of trouble, and they probably got all sorts of skin issues and everything else. So a blood and urine analysis would be something that we, at a minimum, we need to get, because in our field of psychiatry and psychology, we should never give a DSM diagnosis until we rule out a medical etiology. Something's going wrong in their body that's causing the psychiatric presentation. So next, we do EEGs and quantitative EEGs here. And I got two neurologists that work on my team. One's a pediatric, one's an adult. And we want to rule out certain things. Encephalopathy, number one, could there be something going on in their brain that causes them to feel like they do and to stay in the games? Also, secondly, is isolated epileptiform discharges. You've heard of the problems that they're having in Korea and Japan with kids that are playing games so much, and young adults and teens, that they actually start having seizures. Well, this could be an issue with a lot of these kids, because when you have this misfiring from the lights flashing and from the high intensity of these video games, it can actually lead to be like a photo strobe that they do in the neurologist office in order to try to elicit a seizure. And lastly, spindling excessive beta, which is a high beta activity that underlies a lot of anxiety and panic issues, but we think it's linked to neuroinflammation. And neuroinflammation can come from extremes of heat, cold, or pain. It can come from psychological trauma, but it can also come from COVID-19. You heard of COVID brain fog. We think we've got a neurobiomarker, EEG biomarker for neuroinflammation. And then I put in here, just added this one, is EMF exposure. My colleague, Dr. Robert Turner, who's a pediatric neurologist we use, he's on the World Health Organization's whole commitment to looking into EMF exposure. So I've got here, you guys might take a picture of this book, or Emma, if you could type it into the text. Excellent book, and it's talking about all the things that are going on with this electronic screen time, the effects of electronic screen time. Really, it's a great book. It's a great read. You can get it on Amazon, as you can always get most everything on Amazon. And then Environmental Health and Trust website, that's the entrust.org, is great. This talks about the radiation we get from our cell phones. And so this is causing a lot of issues, whether you keep them in your pocket, whether you keep them in your jacket pocket, whether you sleep with them next to your bed. 5G is not good for your brain. Remember, your parents always told you never stand right in front of a microwave. Well, microwave penetrates 3 centimeters into the brain. Your cell phones with 5G goes in 5 to 6 centimeters into your brain. So it's causing a lot of issues. So some of these kids who expend a lot of game time, we need to do an assessment to see what kind of EMF exposure that they have, including the routers. So you don't want a router anywhere around any bedrooms. It does produce these EMF signals. So we could go on this for hours, and Dr. Turner could go on for days, but on to the next. So treatment. Address their abnormal labs, assess their guts. We really need to see what we can do to help them feel better, and so that they might see that there's something more they can do besides just sit sit in a chair in front of a computer. And neurofeedback. We do a lot of neurofeedback here at our center. We can rewire the brain that have got these abnormal connections, so that maybe that their social issues could be quite a bit improved if we reconnect those, or their language issues. They wouldn't feel like such a failure in school. If they had the ability to read better or to do math, this is all stuff that we look at, and we can set protocols to work with them. And it tremendously increases. We've got a brain camp here that we do in the summer times, and now we're doing it year round. Intensive 2 sessions, double sessions, 5 days a week for 2 weeks. It gets 20 sessions out of the way. And we've had, in my past experience with doing this, we've had tremendous increases in SAT and ACT scores by really basically tuning the brain. So we can use it for peak performance as well. Psychological assessment and treatment. If there is a trauma history, cognitive behavioral therapy and EMDR would be 2 great interventions. Okay. If there's no trauma history, behavioral therapy and or skilled coaching. That's why I've got Miss Emma. Nobody better to talk to these guys about how they can come up with a different way to live, because they're not going to listen to me, because they know I hate games anyway. So that's why I have Miss Emma. Social skills assessment and treatment. Social skills group must be face-to-face, cannot be on Zoom. We got to get these young people in front. The middle school is the most valuable time to develop some sort of self-identity. And it's hard to develop a self-identity when the only identity you have is a cyber identity. You got to get exposure to people. So, and that's really a very fascinating concept to a lot of people, that you're going to have to interview for a job one day. You're going to have to. I can't believe how these past two generations hate to talk on the phone. They'd rather text. It's just amazing. It's like, no, you need to call them. You don't just need to text them. And texting can be so misunderstood, especially by me. But so this is one thing that I think is going to be very valuable, is to get them into a group, starting to develop those skills of basic conversation. And of course, the big thing is parent and family assessment and treatment. Parent training, if the parents aren't willing to, I tell the parents all the time, if your child was drinking alcohol with as many hours as they're playing a video game in your house, would you have alcohol in your house? Of course, they say no. I said, well, it's the same thing. If you can't regulate it, parents think that their job is to make their kids happy. That's not your job. Your job is to prepare them to be fully independent, tax-paying citizens eventually. We got to get them to where they want to grow and to develop a family and to have children, marry, and all this other kind of fun stuff, have a job, have a passion. And if they're so comfortable at home, why do I want to leave? How many 16-year-old boys have I ran into that don't want to get a driver's license? That's totally foreign when in my generation. Don't want to get a driver's license. No, they're just happy to be driven around by their parents. That's not normal progression. We delay our children from growing up until they're 21 out of college. And, some societies, they're 14 years old. They run them out into the forest or the desert. By the time they come back, they have full rights of an adult. We delay it so long that I think it's really thwarting their development. And the family therapy is, how can we work together to change things in the family? Sure, it's going to be tough that first week or two when they go through the withdrawals. Thank you, Ms. Emma. And the family has got to work together on this. The last thing we want is to the child to become a house pet. And I use that term kind of lightly but seriously, because these children are usually very nice kids. As long as you don't require much out of them, they are just really nice kids. But in summary, internet gaming disorder requires a physiological, psychological, and social approach. Dr. Melissa Jones, who's a pediatric neurologist, and Katie, that I really just think she's a wonderful person. She's more of a functional neurologist because she'll go with the extra mile. I asked her for a statement one time about our work together, and she said, healing the brain needs to be approached from multiple angles, including an accurate diagnosis, removing toxins, reducing inflammation, appropriate medications, and neurofeedback. Doing one without the other is only treating part of the problem, and the true healing is less likely to occur. I thought that was a great statement from her, because we have to address the physiology. We can't overlook it. And that's one thing I think in the substance abuse treatment programs, they overlook that. They go right just directly to, it's all about the alcohol. Well, this is not just all about the video gaming. It's about the person that got wrapped up into it. What was the motivation to get into it? What can we do to help them out of it? And I want to open it up for questions now, guys. This is all about leaving time for you guys to talk to me. So let me stop sharing. We'll see everybody again. Oh, I do want to say one thing. Hi, Eric. I do want to say one thing, that I've developed a questionnaire, a screening questionnaire. I'm glad to share it with you guys. And I've developed a program. I can share it with you guys. Just send me an email. If you put my email in the text for me or in the chat for me so they can have that, I'll be glad to talk with them. And Melanie, you're up there in spring and everything else. We can work on some sort of together on something. I'd be happy to do that, collaborate with you. Okay. Because I can't drive to spring. They can't drive here. you know. All right. Yes, Eric, how you doing, sir?
I'm doing well. Superb presentation. Really, I really appreciate it. I have a couple of comments or half questions and comments. One, I often look at this and say, hey, the young people need grandmother therapy or grandfather therapy, the kind of rules which no longer exist, or that sense of responsibility of tasks. But going back, I think the initial part, which I don't think you had quite addressed maybe, of why is it that children or young boys quickly sit in front of computers besides the content, I think it is really like an evolutionary trap. If we were 20,000 years ago, then any change in the scene would capture our attention. Mm-hmm. And now the computer games have maximized essentially that evolutionary or that almost reflex response to look for novelty. And so and we have no control over that. It's no different than the food they eat. I hate to say that, like the sugars. And that so one is the question I would say is, what about that perspective? I have two about the sense, is it driven even less by the reinforcers, but it's a step before that, I would say, an evolutionary trap for survival. Oops, I see something change, I must look at that. So that is where attention is driven, is evoked from the outside, versus what a successful student does is they direct their own attention from the inside.
Right. And the problem is that there's no consequences for poor decisions.
That's right.
There's no consequences. If it's in the real world and you get sucked into a trap over there and you end up in quicksand or you end up eaten by a lion, there's a consequence for that move, that impulsivity. In the games, it's rewarded.
Right.
So
the second one, and that is, I wonder if you may comment more about food for a second, because when I look at my students at San Francisco State, 1/3 of the students come to class, even at 12 o'clock, never having eaten breakfast. And then much of the foods, and especially of the people I've seen, it's a predominance of, I would say, of high processed foods, which, and then they have no parents at home who set guidelines, because both parents may be working. So food becomes their positive reinforcer in a sense of loneliness or whatever.
And that's why I talked about the nutritional assessment, because these kids we know eat terribly, and we need to change their diet, because if you don't look at the initial building blocks of life and energy, you're not going to be where you need to be.
Correct.
Yeah, and additionally, oftentimes it's not even that they eat poorly. Sometimes they just neglect to eat at all, and there's like almost no fuel for the brain to actually do what it needs to do.
Yes.
Great. And I think that's one thing that I always want people to know when they come in to see me. If I'm going to do an EEG, they have to eat protein before they come in. Otherwise, we're looking at a brain that's hypoglycemic. It's not the same brain. Other questions? Go ahead.
But that would be really useful for almost like a feedback paradigm, where you show to the person the brain that is on hypoglycemia. It's like almost like when you do fasting, hyperventilation, and you get this massive change sometimes, versus when the brain is with protein and they repeat it, and they can maybe then almost see it looking at their own patterns.
Yeah, I did that and got some really good EEGs from that. And that's when I discovered I need to make sure everybody eats, because I don't want to do this thing. You got to look at a brain that's got some fuel in it to really know where the baseline is. Okay, any other questions from out the audience? Yes, Melanie.
I also, as a marriage counselor, it's not just the young people, it's husbands. I hear a big complaint about, they come home from work and then they go in and play games, supposedly for a few hours, but then it becomes all night. And I think part of it is a lack of friends. That's where they go to hang out with their friends and their buddies, and I'm sure some women also as well, do this, but I'm mostly hear the complaints from the wives. But, I think the social aspect is big as well.
Well, in that study I did in 2000, Melanie, because of whatever's going on in a person's life, and let's just talk about the males, for instance, they'll use different methods to internally isolate from having to deal with those issues. They're having relationship issues. Well, I'm in the game, I'm not thinking about it. Now, we used to use sports. There's sportaholic guys come home,
Mhm.
turn on, there's
Mhm.
178 baseball games in a season. They'll watch every one of them, you know. At the fire department, that's all it was all about. It was sports 24/7, drove me crazy. They'll
Uh-huh.
use alcohol. They'll use, some of them will get into going to strip clubs. Some of them, you know, there's just constantly
Gambling,
gambling. Yeah. And now the women,
Mhm.
in the
Shopping,
70s, yeah, shopaholics, in the 70s, they got into what two things really heavily that helped them not deal with their issues?
romance novels.
Romance novels. Yes, you're right on. And soap operas, you
Oh,
know?
yes, soap operas.
Yeah, because they're
Grandmother
buried
and
in
mother.
there.
Mhm.
Exactly.
Oh,
So all the ways that we can internally isolate. I've got cutters. I've got eating disorders. I've got, these are all ways to not deal with your stuff. And what's the most
it's like
permanent way?
all of these, and here's the problem.
Right. And so, what is the most permanent internal isolate? You never have to deal with yourself again if you cure yourself. That's an, you know, internal isolate. So, the development of psychopathology is that these internal isolates keep us from dealing with our stuff. And the biggest heroin addict I knew could quote the Bible from back to front, and he was buried in religion. Kidaholics, mothers are all about their children and nothing about themselves. So there's so many things that people can do. Yeah, Eric, go
I
ahead.
think, you know, when I think about this, and I think especially of my students and even my clients, what I see is that we are putting the, if I took it as the concept of evolutionary traps where you're captured by, you know, and it's almost easier to watch a game or to watch, to play games than to deal with the family conflict or whatever. But what I see is that we are demanding the almost voluntary control by an individual when they in fact don't have that power, and it's really environmental and social. And I'm thinking, not thinking, I mean, I'm unbelievably impressed by the Chinese model right now, where they have just put limitations, you know, they're just on the use of any gaming for kids that's no more than 90 minutes a week in total. And they just proposed, which will be implemented, the no use of any cell phones or anything for more than 2 hours a day max, and
Wow.
for kids under 18, and only 40 minutes, I forgot the exact, 40 minutes for kids under 14, and they're not allowed to use, and the internet is shut off for everybody from 10 o'clock till 6 a.m. in the morning. That's the newest guidelines. Now, I don't like government regulations in one hand, but at the same time, I would say, it's like, I look at the same thing as sugars and foods, unless we change our hyper refined, you know, ultra refined foods, which is really an government, I mean, I would say a governmental regulation. And at the individual level, it's almost impossible because you're going against our evolutionary survival mechanisms, which allowed us as human beings to survive for thousands of generations.
Right. You know, this is a all-encompassing area, and I think we could get off on all these tangents and
Yes.
talk about every generation out there. I mean, we all have our ways of not dealing with stuff. And you know, mine is science. Okay, I'll admit it. I spent a lot of time reading science here. Okay, but I learned something. So I think that that's what we have right now is what can we do? Because I'm really concerned about the males. I did a study in 2014 on 2012 data, I think it was, because I was invited to Texas Health Science Center about a video game presentation, the gaming presentation they were doing, because I had just published an article in it. And I went through that whole presentation, and they had one interesting fact about video gaming, that in the past, this was 10 years, is probably 15 years ago, but in the past 10 years, that the adolescent juvenile crime has actually been reduced since the advent of video gaming. And I went, and being my ADHD impulsive self, I stuck up my hand. I said, I think I might have a thought on that. If you'll check the male success rate in college, you'll probably find that it has declined at the same rate. And sure enough, I didn't have my facts, but I went home and I dug out the statistics and I did a study on it, and I was correct. 1981, even though, and I limited to white females and white males, to get the same socioeconomic class. And I said, in 1981 was the last year that males and females graduated in equal numbers. Before that, males had always dominated the graduation rolls. In 1994, it took the biggest dip. That's with the advent of Mortal Kombat. And so now we have it at 2014 levels, we have it at 38% are graduating. There was another article recent that said the same thing, validated what I'm saying. Males are equally in number in college, but they just don't walk the stage because that's instant gratification versus delayed gratification. And they don't have the stick to it. Now, females are different. Look at Miss Emma. Different gamer altogether. You know, I applaud her. I mean, but females are wired differently. Do you know that there is the reason why males like video gaming more than females? Their amygdalas are 14% larger, so they get a bigger charge. It's interesting, but that's part of our basic research in this. There is a bigger rush for a male to video game and get that success at that than it is a female. I'm not saying Miss Emma's pituitary gland is 14% larger, but just saying, just the facts, ma'am. But so this is a concept that we have to look at. Now, this whole concept we have around video gaming in this male population is that it's a scary thing for people to get involved in, because we're losing this generation. We've got a population. If you go into that Universe 25 and look at that, there's a reason that we're going lower on fertility rates. The population is actually declining. It's all in that study that they originally did in 1972. And when you look at what they call the beautiful males, those are the gamers that they're referring to. And it's, I love to study anthropology and how civilizations rose and fell. And what I found is that once a civilization went from acquisition of knowledge to the games, within 200 to 300 years, they were gone. They were no longer a leader. And entertainment is not beneficial to a progressive society when you're just being entertained. So back to the same thing, being entertained, you're living vicariously through somebody else or another avatar or something. So I think on the societal level, we're looking at some real issues here that's going to affect us for a long time. The population, I think, that's not graduating, I think is the perfect population for gamers. That, these are the not too popular boys that are probably bullied. They crawled into the games. They couldn't crawl out. But if they would have not had the games, they would have been the little engineers with the horn-rimmed glasses and little tape and the pocket protectors, been the engineers, the scientists. I really think that's the cadre of people that we're losing that would have been successful in without the instant gratification addiction that they get into with the games. And I think that's where the real issue is. So this is on a very large scale. And I don't know if we've got a chance to really turn this around, but we got to try. We've got to do something different, and we can't approach it like we do the substance abuse population. We got to do it completely different. And so if you guys have any ideas, I'm always open for something. Yeah, Eric?
No, I don't have any ideas, but if you gave me control to show one slide, I think you may all know this slide, but it really confirms just what you're saying.
Let me see. I don't know how I can do that. Let me see, Eric. Make co-host. Yeah, there's a way. I'm getting good at this. Okay.
Let's see if I can do that. Let me find my slide here. You may have all seen this slide, but it just reminded me of what you're talking about. Because when I talk to people, and probably you do too, many people say it's the pandemic.
No, it was there before.
And now look at this data. This is really survey of drug use. It's massive populations. And look at the difference by age group. And you see, these are going to the ED, emergency department. You see the young people, 18 to 23, going way up in each case. The next group, 24 to 29, goes up. There's almost no change for the people who are 30 to 49. The first group are social media natives. The second group, the second group are basically cell phone natives. The third group are immigrants.
Yeah.
You know, they're cell phone immigrants, and the last one are digital are basically computer immigrants. And you see that for those who are older, 50 plus, there's been no change at all. I thought this was one of the best. I mean, to me, this was one of the more remarkable studies I've seen.
It says it all right there, you know, and
Yes,
that's
sorry.
a very susceptible population.
Yeah, and we have seen a huge increase in this kind of behavior because of the pandemic. It, you know, people couldn't even socialize really in person. The only way they could socialize would be online. So, yeah.
I agree with you, Emma. But the key, I mean, I see this now with my students at San Francisco State. When we offer 2 classes, all our online classes fill and in-person classes don't.
Mm-hmm.
It's literally, I mean, I teach 2 classes, the same class. One is oversubscribed. That's the online class, and the in-person class, people, you know, I can understand that, especially in a commuting college, but still that's a disaster. But the pattern is not that people, oh, I want to underline this, I think. Mm-hmm. When I talk to people, they all say it was the pandemic. Mm-hmm. And I think what Ron is really saying, and and that's what the data I just showed is showing, sure. Wait a minute, the trend was going way up before the pandemic. It just escalated more.
Sure, yeah.
So I think it's a much more serious issue.
Yeah.
But I have a question for both of you, totally differently. To what extent do you think that by playing computer games, that we, or any of the media, that we are really training the attentive process differently in the individual? Because I think of myself, or I think of Ron, as he said, the way he escapes from challenges is to read literature or science literature for fun. I do something, but it means you have to direct your own attention. And in gaming, your attention is captured by reflex patterns.
Right. Mm-hmm. Well, I think that, you know, it's a valid point there that, you know, it's a different brain. It's a different approach. It's a different motivation factor. And, you know, it's something that not a lot of people are talking about right now. Terry, you had your hand up. I want to get what you said because I love your input.
Hi there, Ron. Good to see you. I'm here in Houston, and I am a developmental psychologist and family therapist. And Ron and I have been sort of thinking similarly, sort of tribally for a long time about these things. And in particular, I work with post-trauma and neurological differences. And so, of course, you know, for all of us, what we do in the world when you're hammery, the world looks like a nail, right? So anyway, I think of some of this addiction, especially in the neurodiscrepant population. If the literature, you know, and it's repeated in literature, is accurate to say that children with neurodiscrepancies, by the time they're age 6, they have made the same number of attempts to be social and connected as neurotypical kids. And so what the discouragement of that much failure, of 80% failure for them being the difference. And so I think, you know, often you'll find in developmental psychology the idea that all humans would like to experience mastery of their environment, right? And so if in my we world, I regularly experience loss and some semblance of failure, but you can see where these games enhance the I world, but they bring some semblance of we, right? Mm-hmm. I'm in this game. Mm-hmm. I'm in this world, this community, and I'm empowered. I can develop mastery, and not just developmentally, just that baseline human need for mastery mm-hmm. is quite, you could see, would be quite addictive, right? Like this I world, I have my own moral order. You know, I'm empowered. And why? Now, would I leave this and go back to that where I'm regularly, you know, crashing into the wall socially and lots of failure? So anyway, just we're sort of all saying the same thing, but just maybe just a little bit different lens that way with what I see with this population that I work with primarily. So,
and if we could ever get to that point to where we could benefit from some of those skill sets that we pick up in the games, the problem is they just don't transfer.
Right.
And it's because the instant gratification
Right.
If you want to become a skilled pianist, you got to put in a lot of effort.
Absolutely. So I'm sort of in the business of therapeutically interrupting that I world with my team, right? And as a family therapist, I'm working really hard in the families to help them interrupt that as well. And as you alluded to before, they must swim through the ungraceful middle of trying to interrupt that, and that's what a lot of families, it's hard to do.
It is very hard to do.
Yeah, it's a lot more disruptive, and sometimes it lasts a good long time, but I have seen it many times be successful in that therapeutic interrupt. There's lots of groups of us in programs here in Houston that we all do something just maybe a little bit different with similar ways of thinking, but as a sort of systems way to be impacting and affecting that therapeutic interruption. So anyway.
Yeah, that's a great aspect of it is the socializing part, as being engaged in part of the video game is it's predictable. You kind of have control over the social interaction to a degree.
Right.
You have control over the other characters' socialization and reaction to you. So kind of there's like this this inability to tolerate the unpredictability of social interaction. This like not really building up a skin thick enough to handle, well, maybe this person won't like me, or maybe the social interaction won't go well.
Excellent way to put it. Well, we're about out of time. I just wanted to, part of this whole thing was also to kick this program off here in Houston. But knowing how big Houston is and everything else, anybody with interest to collaborate, to try to get this thing kicked off, I'll be glad to share with you, and I'd love to have your input. I think if we ever, I'm going to put it out on my website. We're going to do all this kind of stuff so we can have the ability to have parents have a place that is specifically designed for their gamers they're concerned about. And but I expect this could light up and become a wildfire in a need in this area once parents see that I don't want my child living with me the rest of my life, and that's going to be the reality of what they have. So we will be sending out recording of this to everybody that registered. If you feel free to pass it on to anybody. If you got any place that you'd like me to present or me and Ms. Simmons to present, that'd be fine. Just let me know about that. And I appreciate everybody's attendance and input into this. This is a big deal right now. And like I say, I'm kind of really connected to this because I don't want to lose this generation. We need to have this generation back. And we haven't found a way to help them that much so far. So with approaching it from a multidisciplinary perspective, I think is how it's going to be done. And any last comments from anybody? Yes, Eric?
I'll do the last comment, and that is when I look around and I go to the playground, what I see is daycare people, or I see whoever, parents, and they have a little baby and they are on the phone, and when the child is trying to get attention, they don't see that, they are looking at their phone or that part. So we're really training that kind of non-attent or almost that loss of social connection. So if I have any thoughts at all,